What if I told you that the master controller of your body's metabolism, like the gland responsible for everything from your heart rate to your brain development,
Mhm.
was actually named after a piece of ancient Greek armor,
Right.
and the guy who named it had absolutely no idea what the organ actually did?
It really is one of the great historical ironies of medicine.
Hmm.
So back in 1656, there was this English anatomist, Thomas Wharton,
Okay.
and he was writing this treatise, and he basically needed a name for the cartilage in the throat, what we would call the Adam's apple today.
Right.
So he borrowed the Greek word thyreos, which means a large oblong shield, and eidos, meaning form, so shield-shaped. But the crazy part is, he wasn't even naming the gland itself. He was literally just naming the cartilage.
Wow.
Yeah, the little butterfly-shaped organ sitting just below it. It simply inherited the name because of its real estate.
That is, I mean, it's literally like naming a VIP after the bouncer standing outside the club just because, they happen to be standing next to each other.
Yeah.
Horton had absolutely no clue about hormones. Yet today, you look at a doctor's chart and you see a word like hypothyroidism or thyrotoxicosis, and it feels so deliberate.
It does.
It feels like a smell book, right? Or like this foreign language designed to just completely keep you out of the loop as a patient.
Which is such a shame, honestly, because when you strip away that intimidation factor, medical terminology isn't a spell book at all. It is a highly rational construction kit.
Like Lego blocks.
Basically, yeah. It's a Lego set.
Yeah.
Once you understand the basic grammar of prefixes, roots, and suffixes, you stop trying to memorize a dictionary and you just start reading the building blocks.
Okay, let's unpack this. Today, you and I are doing a deep dive into a really fascinating stack of medical terminology notes, and they're focused specifically on glands and skin.
Yeah, these notes are fantastic.
And we are anchoring our whole exploration today on two heavily utilized words: hypothyroidism and dermatitis. Because whether you're prepping for a clinical exam or you're just trying to decode your own lab results, or maybe you're just wildly curious about human physiology, understanding this structural logic gives you a master key.
It really does, because the
Yeah.
system is completely universal. The medical construction kit basically relies on three main components, right?
Right.
You have a prefix at the beginning, which usually modifies the degree or position of something. You have root, which is typically the body part in question. And then you have a suffix at the end, which describes a condition or a procedure.
Okay, so let's apply that to our first anchor word, hyperthyroidism.
We'll do it.
So we take the prefix hypo, meaning below or deficient. Then we take the root thyroid, our, shield-shaped bouncer in the neck, and the suffix ism, meaning a condition or a state of.
Right.
So literally the state of a deficient thyroid.
Perfectly said. And then for our second anchor word, dermatitis, we take the root dermato, meaning skin, and we add the suffix itis, meaning inflammation.
Literally just inflammation of the skin.
Exactly.
See, on paper, that feels incredibly tidy. It's so clean. But to truly appreciate the power of these Lego blocks, we have to look at how much mileage you get from a single root word.
Oh, absolutely.
So take the thyroid. We know it acts as the metabolic engine for the body's cells, right? It dictates how fast or slow they burn energy. If we add the suffix itis to the root, we get thyroiditis.
An inflammation of that engine.
Right. And if a surgeon goes in and physically cuts the gland out, we add the suffix ectomy, meaning surgical removal, which gives us thyroidectomy.
And we can also swap the prefixes to describe entirely different systemic crises, too. So we mentioned hypo for a deficient state. But if we change that to hyperphae, meaning above or excessive,
We get hyperthyroidism.
exactly. This is a state where the metabolic engine is just running completely out of control. And if we combine the root thyro with toxic, meaning poison, and the suffix osis, meaning an abnormal condition, we arrive at thyrotoxicosis.
Man, that sounds so intense. A toxic thyroid.
It really is. It describes the physiological state of your body's tissues essentially being poisoned by an overwhelming flood of thyroid hormone.
Like it's just drowning in it.
Yeah, exactly.
Yeah.
And it doesn't even matter if your gland went rogue and produced too much naturally, or if you accidentally swallowed a massive dose of synthetic hormone medication.
Oh, wow. So the origin doesn't matter for the word.
Right, the word just describes the end result.
Yeah.
Tissues drowning in metabolic signals.
That makes a lot of sense. So I want to run the exact same logic on the skin root, dermato.
Go for it.
If we add the suffix ology, meaning the study of, we get dermatology.
Right.
If we take the root derm and stick the prefix ep on the front, which means upon or above, we get the epidermis, the outermost layer sitting literally upon the deeper skin.
Which is very literal when you think about it.
Super literal. Or Let's look at a systemic condition from the notes. The prefix erythro means red. Slap that on a derma and you get erythroderma. The sources flag this as a really critical dermatologic emergency.
Yeah, it's a massive issue. It's where the vast majority of a patient's body surface becomes red, inflamed, and completely compromised.
So you're just snapping the blocks together seamlessly. But I guess relying on the blocks requires actually understanding what the individual pieces mean, biologically speaking.
It does. You can't just know the translation. You have to know the mechanism.
Which brings up a question I have to ask on behalf of, well, basically anyone who has ever sat in an urgent care clinic.
Uh-oh. What is it?
We throw around the suffix itis constantly. Bronchitis, sinusitis, dermatitis. There is this massive public assumption that an itis means a bug.
Oh, yeah.
Like, people walk into clinics demanding antibiotics because they have an itis. So is there an infection hiding inside dermatitis?
I am so glad you brought that up because it represents a fundamental misunderstanding of human biology. The suffix itis strictly means inflammation.
Just inflammation.
That is all it means, full stop. It describes a physical mechanism. Your blood vessels are dilating to bring extra blood flow to an area, which causes redness and heat, while white blood cells rush into the tissue, causing swelling.
So the swelling and redness are basically just the body's alarm system going off.
Precisely. It's just the alarm. And that alarm can be tripped by 100 different intruders that have absolutely nothing to do with bacteria or viruses.
Like what?
Well, you could trip the alarm with an allergen, a harsh chemical irritant, a physical burn, or even your own immune system malfunctioning.
Oh, right. Autoimmune issues.
Right. Think of appendicitis. That inflammation is usually caused by a physical blockage in the tube, not some invading bug. Dermatitis is the exact same thing.
So the skin is inflamed, but slapping an antibacterial cream on it won't do a single thing if the trigger was like a nickel belt buckle.
Exactly. The cream won't fix a metal allergy. That distinction is so crucial.
Now, we see how rigidly these definitions operate today, but the history of how we actually arrived at these tidy terms it's anything but rigid.
It was incredibly messy.
Yeah, it was a chaotic process of doctors observing physical changes literally decades before they understood the invisible chemistry happening underneath.
Oh, totally. The clinical reality of a failing thyroid was documented long before anyone understood what a hormone even was.
Yeah.
So in 1873, there was this prominent London physician named Sir William Withy Gull,
Okay.
and he published a paper describing this very specific decline in adult women. They developed extreme lethargy, profound mental slowing, and this bizarre, doughy puffiness in their skin.
Right, the tretinoid stit, I think he called it.
Exactly. And then 5 years later, another physician, William Miller Ord, autopsied similar patients, and he coined a term for it, myxedema.
Okay, let's use the kid again on that word. Myxixa is Greek for mucus, and edema means swelling, so mucus swelling. But why mucus? Why does a failing metabolic engine make your skin swell with mucus?
It comes down to basically cellular housekeeping. So in a healthy body, your tissues are constantly building and breaking down these complex carbohydrate molecules called mucins.
Okay.
But when you lack thyroid hormone, your cellular metabolism just grinds to a halt. The cells literally stop clearing out the trash.
Wow.
So these mucin molecules accumulate in the skin, and because they are highly hydrophilic, meaning they attract and hold on to water, they pull fluid into the tissue.
So the skin just becomes totally waterlogged and puffy.
Exactly.
Right.
But unlike normal swelling, if you press your finger into it, it doesn't leave a pit. It's this firm, doughy swelling.
So Ord names the consequence myxedema, but he still doesn't know the cause. They still don't know the thyroid is actually the culprit here.
Right. The smoking gun didn't arrive until the 1880s, and it came through a really rather gruesome surgical realization.
Yeah, this part of the notes was wild.
It's intense. There was a Swiss surgeon named Emil Theodor Kocher. He was performing thousands of total thyroidectomies, basically removing massively enlarged thyroids, known as goiters.
Because they were crushing the patient's windpipes, right?
Exactly. They were suffocating. Kocher was a brilliant technical surgeon, so his patients actually survived the operations, which was a big deal back then. But within months, he noticed something horrifying.
Let me guess.
These supposedly cured patients were descending into the exact same lethargic, doughy, myxedematous state that Gull and Ord had described earlier.
Oh, man. So by physically removing the organ, he accidentally completely replicated the disease?
Yes. He accidentally disabled his patients. But in doing so, he proved that the gland wasn't just some useless lump of flesh. It was actively secreting something absolutely essential for human vitality.
Which is a tragic but completely groundbreaking realization.
It completely reframed the disease. It eventually earned Kocher a Nobel Prize in 1909.
That evolution from guessing at invisible causes to rigorously observing physical reality is the exact same arc you see in the history of skin dermatology.
Oh, 100%.
Because if you go back to the 18th century, dermatology was really plagued by what was basically folk taxonomy. Like if you had a rash, a doctor might blame it on bad humors or, I don't know, corrupted blood. The language was incredibly vague and clinically useless.
Because they were trying to name diseases based on invisible internal states that they couldn't actually measure.
Right. Until an English physician named Robert Willen comes along in the late 1700s. He and his student Thomas Bateman, they completely flipped the script.
He got so fed up with the vague humor stuff.
Yes. Instead of guessing about internal humors, they created the very first systematic classification of skin diseases based strictly on what was physically visible on the patient, the primary lesion.
They just categorized the raw visual data. So is the lesion a flat, discolored spot? Boom, that's a macule.
Right.
Is it a raised solid bump? That's a papule. Is it a blister filled with pus? That's a pustule.
And by anchoring the vocabulary to observable physical structures, Willen birthed the modern nomenclature that dermatologists still rely on today to categorize inflammation. He basically took the guesswork out of the descriptive language.
He did. But here is the paradox of medical progress, right? Willen and Kocher brought incredible clarity to their fields by tying vocabulary to visible physical signs.
Sure.
However, as our diagnostic tools evolved over the next century, moving from just the naked eye to the microscope and then to molecular chemistry, those tidy boundaries began to fracture.
Because the closer you look at the biology, the blurrier the lines become.
Exactly. Let's look at the primary fault line in modern hypothyroidism. For a century, diagnosis required physical symptoms, the fatigue, the cold intolerance, the myxedema.
Stuff you could see and feel.
Right. But in the 1970s, scientists developed these incredibly sensitive blood assays to measure TSH, or thyroid-stimulating hormone.
Okay, to really grasp why this disrupted everything, we need to understand the mechanism here. And the notes use this great analogy, the thermostat and the furnace.
That is the perfect analogy. So think of your thyroid gland as the furnace in your basement, right? It's producing heat in the form of hormones called T4 and T3.
Right.
But the thyroid doesn't decide when to turn on. The thermostat is actually a tiny gland in your brain called the pituitary.
And the pituitary constantly reads the temperature of the blood.
Exactly. If the hormone levels drop too low, the pituitary pumps out TSH, thyroid-stimulating hormone.
So PSH is basically the electrical signal yelling at the furnace to fire up and make more heat.
Yes. So if your thyroid starts failing, your brain starts screaming. The TSH levels in your blood skyrocket before the furnace completely breaks down.
Wow. Okay, so when those TSH blood tests hit the clinics, doctors suddenly discovered this massive population, roughly 4 to 10% of all adults who had abnormally high TSH levels, but their actual thyroid hormone, their free T4, was still totally in the normal range.
Right. And more importantly, these patients felt completely fine. They had zero physical symptoms.
So this birthed an entirely new diagnostic category, subclinical hypothyroidism.
Which fundamentally changes the definition of a disease, doesn't it?
Yeah.
You are no longer diagnosing a sick patient. You are diagnosing a piece of paper with an abnormal lab value.
Which leads to a massive debate. Do you treat it?
This raises an important question that medical societies are literally still fighting over today. Do you prescribe a daily synthetic hormone pill to a patient who feels perfectly healthy, hoping it prevents them from developing heart disease or cognitive decline a decade later?
Oh, wow.
Or, by medicating them, are you pushing their hormone levels too high, exposing them to the risks of hyperthyroidism, like accelerated bone loss and dangerous heart arrhythmias?
You are basically gambling with the thermostat.
Exactly.
And we see a similarly intense debate with our other anchor word, dermatitis. We established earlier that dermatitis simply means a pattern of inflammation.
Right.
But when we look at the underlying mechanisms, the word covers biological events that have almost nothing in common.
It acts as an umbrella. So take allergic contact dermatitis. If you wear, like, a cheap necklace, your immune system might identify the nickel as a hostile invader.
Okay.
It memorizes the metal, unleashes a cascade of specialized T cells, and attacks the skin where the metal touched you. That is a pure immunological reaction.
But then you have seborrheic dermatitis, which causes dandruff and red, flaky patches on the face. And that is not an allergy. That is caused by a naturally occurring yeast on your skin called malassezia.
Right. The yeast just overfeeds on the oily sebum your skin produces, and its waste products irritate the tissue, triggering the alarm system.
And then you have actinic dermatitis, where the inflammation is triggered by chronic ultraviolet radiation from the sun, literally damaging the DNA in your skin cells.
Right, so you have an immune allergy, a fungal irritation, and radiation damage, all lumped under the exact same itizitis suffix.
It's so broad.
Dermatologists have argued for decades whether this terminology clarifies the science or actively obscures it.
And the terminology war gets even more heated when you look at eczema. In the notes, we have atopic dermatitis. Let's decode that. The prefix a means without, and topos means place, so out of place.
Coined in 1923, yeah, by two allergists, Coca and Cook, to describe these strange hereditary hypersensitivities.
Right. Today, we recognize it as a chronic, intensely itchy skin condition that typically runs in families, often alongside asthma and hay fever.
But depending on what side of the Atlantic you practice medicine on, you might use completely different words for it.
This blew my mind. So in the United States, doctors and patients use the terms eczema and atopic dermatitis completely interchangeably.
Right. To them, eczema is atopic dermatitis.
But in the UK and much of Europe, eczema is utilized as the broad umbrella term, and dermatitis is reserved specifically for inflammation caused by external agents, like that nickel necklace you mentioned.
This is not just some casual disagreement over slang either.
Mm.
Textbooks fundamentally disagree on the classification hierarchy. It is a profound nosological debate.
Nosological.
Yeah, a debate about the philosophy of how we organize and classify human disease.
And the reason this philosophy matters so much is because the words dictate the definitions, and the definitions dictate the treatments. When we get the mechanisms right, it leads to some of the most staggering public health victories in human history.
The eradication of endemic cretinism is a prime example of this. Historically, infants born without a functional thyroid gland suffered catastrophic consequences.
Because thyroid hormone is absolute fuel for the developing brain, right?
Exactly. A lack of it in the first years of life caused irreversible, severe intellectual disability and stunted growth. And because the physical symptoms weren't obvious at birth, the diagnosis usually came months too late.
Until a pediatric endocrinologist in Quebec named Jean Dussal changed the world.
Yes, in 1974.
He pioneered a radioimmunoassay technique that could detect thyroid hormone levels from a single drop of dried blood, the newborn heel prick test.
By taking that tiny sample in the first days of life, doctors could identify congenital hypothyroidism before any brain damage occurred.
Incredible.
They could immediately prescribe an inexpensive, crushed-up hormone pill. And that simple intervention allowed for completely normal neurological development, virtually eliminating a massive cause of intellectual disability worldwide.
It is genuinely breathtaking, and it pairs perfectly with another historical triumph in these notes, the story of iodized salt.
Oh, this is a classic.
Yeah, in the 1910s, researchers David Marine and O.P. Kimball ran a field trial in Akron, Ohio, to see if they could prevent goiters in schoolgirls.
To understand why this worked, you have to look at how the thyroid manufactures its hormones. The T4 and T3 designations actually refer to the number of iodine atoms attached to the hormone molecule.
Oh, I never knew that.
Yeah. Your thyroid is essentially a massive trap for iodine circulating in your blood. If your diet lacks iodine, the furnace has no fuel.
So the gland swells up, trying desperately to capture whatever trace amounts it can find, resulting in a massive goiter and plunging the body into severe hypothyroidism.
Exactly. So Marine and Kimball proved that giving tiny prophylactic doses of iodine completely prevented the goiters.
Which led to Michigan launching the first American iodized salt program in 1924, right after Switzerland pioneered it in 1922. By simply mixing a trace mineral into standard table salt, they executed one of the cheapest, most effective public health interventions in recorded history.
It is an elegant solution born directly from understanding the mechanism. The same is true for Hashimoto's thyroiditis.
Right, let's talk about that.
In 1912, a Japanese surgeon named Hikaru Hashimoto examined enlarged thyroid glands under a microscope and saw something bizarre. The tissue was absolutely swarming with lymphocytes' white blood cells. He called it struma lymphomatosa.
The immune system had literally invaded the gland.
Yes. For reasons still not entirely understood, the patient's own immune system had mistakenly tagged the thyroid tissue as a foreign threat.
Wow.
The white blood cells were systematically infiltrating and destroying the metabolic engine. And it took the medical establishment 40 years to fully grasp what Hashimoto had documented.
Which was the very first recognized human autoimmune disease.
Yeah.
Here's where it gets really interesting, though. Once you identify the biological mechanism, Whether it's an iodine deficiency or an autoimmune attack, you have the power to treat it.
Right.
But when mechanisms are ignored and we rely purely on vague symptoms, we enter the dark side of medical terminology.
The fringe fictions.
Yeah, because the wellness industry knows that symptoms of hypothyroidism like fatigue, brain fog, and dry skin are incredibly common and incredibly frustrating for people.
When a patient feels terrible, but their TSH and free T4 blood tests come back perfectly normal, they are left in a very vulnerable void. They want an answer, and they want a label.
And in 1990, a physician named E. Dennis Wilson capitalized on that void. He proposed something he called Wilson's temperature syndrome.
Oh boy.
He claimed that if you had a slightly lower than average body temperature and those vague lethargic symptoms, you had a unique syndrome that standard blood tests couldn't detect.
And, conveniently, the only way to fix it was with his highly specific proprietary dosing protocol of T3 hormone.
Nah.
It was a masterclass in exploiting terminology. There was zero peer-reviewed validation for the mechanism he proposed. Professional endocrine societies universally rejected it as an unfalsifiable diagnosis.
It's just made up.
Yeah, and pushing unproven hormone treatments on patients with normal thyroid function eventually led the Texas State Medical Board to place Wilson's license on probation in 1994.
But the marketing template was set, borrow the clinical gravity of a real word, blur the biological mechanism, and sell a cure.
Exactly.
This is exactly why internalizing the medical construction kit is a critical form of self-defense for you as a patient.
If you connect this to the bigger picture, the takeaways are incredibly clear. First, master the prefix, root, and suffix blocks. You don't need a medical degree to parse a chart. You just need to know how the Legos snap together.
Right.
Second, demand to know the mechanism. If someone tells you have an itis, ask what is tripping the alarm.
And be aware of the pop culture myths, too. Like a huge misconception is that hypothyroidism causes massive dramatic weight gain.
Right. In reality, the weight change is mostly just fluid accumulation from those water-trapping mucins we talked about.
It is rarely more than 5 or 10 pounds, and it's not fat.
You also must avoid the dangerous error of confusing hypo and hyperamylone. They're physiological opposites. One is a stalled engine causing a plunging heart rate and hypothermia. The other is a runaway engine causing a racing heart and severe anxiety.
So treating one with the protocols for the other is a recipe for a medical crisis.
Absolutely. Because the stakes are life and death. The notes are very clear on this. If you ignore severe hypothyroidism for long enough, the metabolic engine completely stalls out.
The myxedema coma.
Yes. The patient descends into a myxedema coma, their breathing slows, their core temperature drops, and they lose consciousness. Even with the best modern intensive care, the mortality rate is staggering.
A sobering reminder that a slow-moving, boring endocrine condition commands absolute respect.
Without a doubt.
So what does this all mean for you? The next time you open an app and look at a lab report featuring TSH or free T4, or you read a dermatologist's note referencing erythema for redness or pruritus for itching, you do not have to be intimidated.
No, you don't.
You can decode the structural logic. You hold the master key.
You really do. But if we consider where this is all heading, I'll leave you with a final thought to mull over.
Okay, let's hear it.
We discussed how the invention of the sensitive TSH blood test suddenly created millions of subclinical patients overnight.
Right. People who felt fine, but were suddenly flagged by the technology as abnormal. The thermostat was catching the microscopic fluctuations.
Exactly. So fast forward 20 years. What happens when diagnostic technology becomes 1,000 times more sensitive? When we can instantly detect microscopic cellular inflammation or transient hormonal dips that we can't even dream of measuring today.
Oh, wow.
Will any of us be considered normal? Or will every single person walking the earth technically have a subclinical angiositis or an anisosis that we need to invent a new Greek word for?
That is wild to think about.
The sharper our tools become, the more we might realize that perfect health is just a biological illusion.
That is a staggering thought. We finally learn how to read the construction kit, only to realize that eventually every single one of us is going to be built into it.
A statistical inevitability.
Well, at least we won't need a translator when the time comes. Keep decoding, everyone. Catch you next time.